Case number 1. A 19-year-old university student has been pulling all-nighters for his upcoming exams. While trying to study, he often finds himself falling asleep with his contact lenses still in. As final week draws to a close, he is scratching his eyes often because they feel dry and painful, as if there are foreign bodies in there. He also notices that his eyes are red and that he tears up frequently. What is the most likely diagnosis? Keratitis caused by the free-living amoeba Acanthamoeba is the most likely diagnosis, and conditions to consider in the differential diagnosis include herpes simplex virus, or HSV, herpes zoster virus, and bacterial or fungal infection. However, HSV keratitis would present with photophobia, decreased visual acuity, and dendritic ulcer formation, which are not seen in this patient. Likewise, a bacterial or fungal source would present with accompanying systemic symptoms, and orbital cellulitis would create an ophthalmologic emergency. What are the risk factors for developing this condition? The number one risk factor for Acanthamoeba infection is extended wearing of contact lenses. Inadequate disinfection of the lenses with homemade saline solution and wearing lenses while swimming or showering can also predispose contact lens wearers to this infection. Acanthamoeba organisms can live in soil, air, and water and are resistant to chlorine. What are other symptoms and complications of this condition? Unlike bacterial keratitis, keratitis from Acanthamoeba takes days or weeks to cause symptoms. The initial symptoms are usually redness and a feeling of a foreign body in the eye. Blurring of vision may also present. Over time, this progresses to pain, lid edema, and conjunctival injection. If untreated, increased intraocular pressure, cataracts, and even loss of vision can develop. How is this condition diagnosed? The diagnosis is made by slit lamp examination of the eye, which shows thickened epithelium and rough corneal nerves. A characteristic ring on the cornea may also appear approximately 6 weeks after initial infection. Corneal scraping or biopsy reveals irregular polygonal cysts. What is the appropriate treatment for this condition? Initial treatment consists of topical antimicrobials such as miconazole and neomycin for several months. If the infection has been left untreated, i.e. the corneal ring stage, surgery such as corneal debridement is usually required. What populations are at risk for this condition? Populations include chronic disease patients such as those with lymphoproliferative disorders, patients on chronic steroids, patients receiving chemotherapy, and patients with AIDS. In these populations, the infection is usually not of the eye, but rather of the central nervous system. These patients present with changes in mental status, headache, and stiff neck. They can also develop cranial nerve palsies, ataxia, and hemiparesis, termed granulomatous amoebic encephalitis, and treatment is urgent in such cases.